these cells start dividing and the body can't control the way they are dividing. And the expression we usually use is they're like wild horses. You can train a horse, which is the rest of our cells, to go around and do things for you. And then you have wild horses who will attack you even and kick you and stuff like that. So this becomes like a wild horse.
In the 1970s ka India, where you were in AIIMS, the medical infrastructure there, and now obviously after 30, 35 years, you have seen a vast growth, difference, learnings into it. Can you just give me a little glimpse of that journey?
Well, I joined the faculty at AIIMS 74, 75. And I ended up leaving in about 2005 because I had other commitments that I had created for myself. I was a professor in the Department of Pathology, which meant that we were consultants to the consultants who were working there. Because without a diagnosis from us, they can't treat the patient. So that's actually what attracted me to pathology, that I was going to be with patients, but I was going to be doing it at a different level, right? So I was there. We used to, teach undergraduates, postgraduates, things like that. And it was fairly busy. We had a fair number of research projects that we got involved in. Each one of us had our own little field of specialization in pathology. And I ended up in oncology, cancer.
Cancer.
For various reasons. We can go into that a little later. And let's see. So, you have your research projects that you're working on, get your publications. And I always knew that if I'm going to be able to join pathology at AIIMS, and that was mainly because some of my training was abroad and I had to come back and settle myself into it. Lucky I got there. What I found was that at that time, cancer was something that people said, oh, this person, ab to ye gaya. Which to me was unacceptable as a doctor.
It was like a taboo.
It was, people just said, ab to ye gaya.
Yeah.
Isne nahi bachna.
हाँ, मतलब जैसे ही हुआ वैसे ही confirm हो गया कि भाई
जाना है. This is, and a lot of people were not aware about cancer. Now, what you think about cancer, it's not one disease. It's like saying, mujhe infection ho gaya. You have to first find out where the infection is, what kind of an infection it is. Similarly, in cancer, you have to find out not only what kind of a cancer it is. There are about 150 to 170 cancers in the world, as we know it today. And not only that, there has to be a spectrum. Some cancers are very aggressive. Some cancers are not so aggressive. Also, within the same cancer, depending on the individual who has it, it may be the person's immune system, a lot of things we don't understand, the molecular makeup, the genetic makeup, which decides how he's going to or she's going to react to the cancer. So, as a pathologist, this is all I got involved in. And it got more and more complicated as medicine progressed. What we can do today in making these decisions, we couldn't do when I joined.
Can I ask you, can I pause you and ask you a couple of things that are popping up in my head? I want to give, because I know a lot of people are not from science background, I want to give them a little insight of what actually pathology is, and what is a biopsy. Because I think these are very related terms to cancer, because that will make a clear picture in their head what you are doing.
Well, what is cancer? I'll use the expression I use when I'm teaching undergraduates. Cancer, you think of the cells, you see, you cut yourself, it heals. And then it's finished. There's just a little scar left. Which means that the cells are being regulated. All right? Now, for some reason, some of which we understand, some of which we don't. Some cells in the body decide, I'm not going to get controlled by these people and this system.
Rebel cells.
And that the rebels, you can say they're the rebels of our cells. That's giving them too much honor, I think. I'd just say they're what we call in medicine the mutations.
Mutations,
Whatever
true.
happened. And these cells start dividing, and the body can't control the way they are dividing. And the expression we usually use is they're like wild horses. You can train a horse, which is the rest of our cells, to go around and do things for you. And then you have wild horses who will attack you even and kick you and stuff like that. So this becomes like a wild horse, this cell.
Aggressively multiplying.
Aggressively multiplying. The body has no control on it or has limited control on it. And that becomes what we call a tumor, or a malignant tumor is the right word for it.
Correct.
Okay, that means it's a cancer.
क्योंकि normally लोग ऐसे बोलते हैं ना गांठ हो गई है मुझे. Like when
गांठ हो गई, बिल्कुल.
सही ये word use करते हैं
गांठ होती है तो the first thing गांठ जब होती है डिसाइड करना होता है कि ये गांठ just ordinary सी गांठ है which we
cut it off and
nothing happens.
Nothing happens.
Or is it a cancer? ये malignant तो नहीं है. Because, and once we establish the malignancy, we have to figure out कि ये किस grade की है, how aggressive is it, इस बंदे का immune system कैसे है, how can we control it best? That is the decision. Has it spread to other parts of the body? That also is very important. That we call, to use a technical term, staging of the cancer. So anytime cancer को treat करना है, you have to know what kind it is, what kind of grading it has, and what is the stage. Is it limited to where that cell went wild in the body, or has it spread to other parts of the body? Because therapy, treatment के लिए, this becomes very important. The only thing is, there is another element that comes in,
बताओ.
Which is called cancer screening.
Okay.
Because there are some cancers in which, if we are regularly, like you get a health checkup, you get a cancer checkup, in which we can diagnose that this is going to become a cancer later on. And that is where cancer screening becomes important. Because उसमें हम pick up कर सकते हैं these early lesions, as we call them, or early changes in the body, which we know will become cancerous later on. तो उसके लिए treatment and handling is a totally different issue.
Correct.
तो उसके लिए, if we catch them at that stage, then we're way ahead of it. We don't even let it become a cancer.
Exactly. तो वो जो गांठ आने वाली थी वो भी नहीं आएगी.
वो भी नहीं आएगी.
हाँ, मैं समझ गया. तो yes, बड़ी बढ़िया चीज है ये. तो a healthy individual, should he get like a cancer screening done every year?
Yes. Well, what recommendations are there? कोई कुछ कहता है. But generally what we advise is for women over 40, you get cancer screening done once, and we look at cancer screening करते हैं common cancers के लिए, like breast cancer in women, cervix cancer in women, oral cancer in the mouth, lung cancer. That's what we screen for.
Thank you so much इस क्लिप को एंड तक देखने के लिए. अगर आपको ऐसी ही इंटरेस्टिंग एंड वैल्यू एडिंग क्लिप्स देखनी है, देन ड्रीम विद नीरज क्लिप्स को सब्सक्राइब कर लीजिए. Until then, keep dreaming. I'll see you in the next one.